Doctor-patient conversation. 100 questions, answers. Hello, how are you feeling today? I'm not feeling very well, doctor. What seems to be the problem? I've been having a headache, and how long have you had this headache? It's been about 3 days. Is the pain constant, or does it come and go? It comes and goes. Is it very severe? Sometimes it feels very strong. Do you feel dizzy as well? Yes, a little bit. Do you have any nausea or vomiting? No, just the headache. Have you taken any medicine? Yes. I took some painkillers. Did the medicine help? Only for a short while. Do you have any allergies? No, I don't have any. Do you have any other medical conditions? Yes, I have high blood pressure. Are you taking medication for it? Yes, I take it every morning. Have you been eating and sleeping well? Not really. I haven't been sleeping well. Do you drink enough water? Maybe not as much as I should. Do you drink coffee or tea often? Yes, about 3 cups a day. That could be a reason. I see. Should I reduce it? Yes, it might help. Okay, I will. Do you feel stressed lately? Yes, very much. Stress can also cause headaches. That makes sense. Do you exercise regularly? Not really. You should try some light exercise. I will try. Have you noticed any vision problems? Yes. Sometimes my eyes hurt. Do you use glasses? Yes, for reading. When was your last eye checkup? Almost 2 years ago. It might be time to check again. All right, I will. Do you smoke or drink alcohol? No, I don't. That's good. Thank you. Do you have a fever? No, I don't think so. Do you have any cough or cold? No, nothing like that. Does anyone in your family have migraines? Yes, my mother does. It could be hereditary. Oh, I didn't know that. Do you spend long hours on your phone or computer? Yes, almost all day. That might also cause eye strain. I should take breaks then. Yes, take a break every 30 minutes. Okay, I will. Would you like me to check your blood pressure? Yes, please. Your blood pressure is a little high. Is that dangerous? It's not too high, but you must be careful. I understand. Are you taking your medicines regularly? Yes, every day. Good, keep doing that. I will. Do you eat salty food often? Yes, I like snacks. You should reduce salt. All right, I'll try. Do you eat fruits and vegetables daily? Not really. You should add more to your diet. Okay, I will. Do you drink enough water during the day? Only 2 or 3 glasses? That's not enough. Drink at least 8. I'll try to remember. Do you work long hours? Yes, sometimes 10 hours a day. That can increase stress? Yes. It feels tiring. Do you take breaks at work? Not often. You should take short breaks. I'll keep that in mind. Do you sleep late at night? Yes, very late. Try to sleep earlier. I will try. Would you like me to prescribe medicine? Yes, please, doctor. I will give you something mild. Thank you. Do you want tablets or syrup? Tablets are fine. All right. Tablets? It is. Okay, doctor. Will I be okay soon? Yes. You should feel better? How long will it take? Maybe a few days. Should I come back for a follow-up? Yes. In 1 week. Okay, I'll come. Good. Do you want me to suggest home remedies? Yes, please. Drink plenty of water and rest well. All right, I will. Should I avoid coffee? Yes. Reduce it slowly. Can I still drink tea? Yes, but not too much. Should I use a hot or cold compress? A cold compress will help. Okay, I'll try it. Yes. Do that twice a day. Should I take vitamins? Yes. Vitamin D and B complex. Where can I get them? At any pharmacy. Do I need any tests? Yes, a blood test would be good. When should I do it? Tomorrow morning, if possible. Do I need to fast before the test? Yes. 8 hours fasting. All right, I'll do that. Good. Do you have any chest pain? No, not at all. Any shortness of breath? No, only the headache. That's good. Yes, I feel relieved. Is my condition serious? No, nothing serious. That's a relief. Yes, don't worry. Is there anything else I should avoid? Avoid junk food and stress? I'll try my best. Good. How much should I rest? At least 7 hours of sleep. I'll make sure of that. Very good. Do you want me to write the prescription now? Yes, please. Here you go. Thank you, doctor. Do you have any more questions? No, that's all for now. All right. Take care of yourself. I will, thank you. Come back if the headache continues. Yes, I'll do that. Goodbye. Goodbye, doctor. Well done. You did amazing practice today. Now you know how to explain your health problems, answer the doctor's questions, and understand medical advice in English. Keep practicing this conversation until you feel confident. If you enjoyed this lesson, don't forget to like, share, and subscribe for more daily English practice. Stay healthy, keep practicing, and I'll see you in the next video. Goodbye for now.